Everyone, today's video is on hydrotherapy equipments. In previous videos we have discussed about the principles, indications, contraindications. In this video we'll be discussing the various equipments available for hydrotherapy. So basic general rules of application: we have to assess the problem and set goal of treatment. Then we have to determine if most appropriate treatment, that which equipment is required, and then we have to make sure there are no contraindications. Then select the appropriate form of hydrotherapy like the Whirlpools, Hubbard Tank, contrast bath, non-immersion devices, pool, whichever device is required. Then we have to explain the procedure, purpose, sensations, everything to the patient. And we have to apply the appropriate form of hydrotherapy. And then we have to assess the outcome, and then we have to make notes or document that. So how we select the hydrotherapy means, now to select the appropriate form of hydrotherapy, it should be according to the condition which is to be treated, treatment effects we require, size of area to be treated, then allowance for safety, if there is any infection, then control of infection, and cost effectiveness. Now firstly we will be discussing the water immersion modalities. They include Whirlpool bath, Hubbard tank, pool, or aquatic therapy. These are the various modalities: extremity Whirlpool, high buoy Whirlpool, low buoy Whirlpool, and these are the chairs for Whirlpool. Now Whirlpools, these are the stainless steel tanks of various sizes, and there is an attached motor which is called turbine. So these turbine, they agitates the water in the tank to create the Whirlpool effect. These Whirlpools are intended to used as single patient treatment, and they must be drained and cleaned after every use. Now Whirlpool parts in general: first is the agitator or turbine ejector, and sometimes it is also called aerator. Then hot and cold water mixing valve will be there, temperature gauge will be there, then gravity drain, and seat or the particular chair could be used. So these are the parts of the Whirlpool bath: on off switch, motor pump or turbine motor, there is a thermometer to maintain the temperature, steel tank, and mostly it have wheels. Now objectives for use: the stimulation of circulation is the major objective. Also it is used to promotion of muscle relaxation and pain relief. Debridement, wound debridement is an important objective that could be achieved by using Whirlpools, especially in the burn cases. The wound debridement can be done. Then facilitation of the exercise. Now low buoy Whirlpool tank, it is designed for ease of transfer in and out of the tank by virtue of low walls and length. So it have low walls and length, and patients in low buoy are usually in a long sitting position. So basically the dimension: width will be around 24 inches, length is 52 to 66 inches, and depth will be 18 inches. Now high buoy Whirlpool tank, it is also referred as hip tanks. So it requires a chair or a lift to transfer the patient in and out of the tank. Now patients in a high buoy tank, they usually sit on a removable seat which is attached to the on the side of the tank, and it may be sitting on the chair outside the tank with their lower extremity dangling in the tank. And dimensions: width will be 20 to 24 inches, length will be 36 to 48 inches, and depth will be 28 inches. Now extremity, third one is the extremity Whirlpool tank. Now it is smaller in size, and it is designed specially to treat the distal extremities like ankle, foot, hand, and it is often portable with the attached wheels for ease of the movement. So this is the extremity tank. So dimensions will be 15 inches width, length will be 28 to 32 inches, and depth will be 18 to 25 inches. So only particular extremity can be treated. Now duration part, the 20-minute duration part will be there when strictly used as a heating modality. So in this we have to maintain the skin, muscle and joint temperature. So 20 minutes if we are using the Whirlpool for heat purpose, and 5 to 20 minutes when used for debridement, that is depending on the amount of necrotic tissue, right? So if there is a wound and we need to remove the dead layer of that wound, that is called debridement. So it could be 5 to 20 minutes if it is used for debridement, and 10 to 20 minutes for exercises, and it depends on the patient's medical status. Now lower extremity, mid thorax level immersion techniques. Now HYDROTHERAPy tank can be used. So it requires the patient to flex their hip and knee and limit the range of motion, and limits the amount of range of motion exercises, but its depth allows a greater body surface area to be submerged safely and comfortably to as high as the mid thorax region. But in this if we are immersing the patient, then definitely the range of motion exercises could not be performed. And low buoy tank, it's not deep, but it allows the patient to fully extend their lower extremity and they can perform the full range of motion exercises. And extremity tank, they are only distal portion of the lower extremity has to be immersed, and then extremity tank with use of chair will be appropriate. So in upper extremity technique, the patient should be seated comfortably next to the extremity tank with a towel or other form of padding on the tank edge to avoid any compression of the axillary area. Temperature range, again if it is using for acute inflammation, the cold treatment is given. It will be 32 to 79 degree Fahrenheit, and if it is for a hot treatment, then it will be 79 to 92 degrees Fahrenheit, and that can be used for exercise and sometimes for acute inflammation also if cold is not tolerated. Next is the temperature range if the heat treatment is given by the Whirlpools for mild warmth, hot, and then is very hot. But we have to consider that we don't use Whirlpools at the temperature more than 110 degree Fahrenheit. Now technique of application will be very simple, that the Whirlpool tank is filled with water. Water temperature is checked by hand and thermometer by the therapist, and then we adjust the position of patient in accordance to the body part which is to be treated, and we have to consider both the comfort and the security of the patient. Then explain the procedure, reassure the patient, place the body part in the water, and we encourage the patient to move while keeping the body part underwater during the treatment in case of joint involvement. Now, and after completion of treatment, we have to dry the body part, wrap it to keep it warm. Next are the therapeutic effects, that the Whirlpool bath, they combines the value of conductive heat and gentle massage. So it will be giving a sedative action, a relief of pain by stimuli which acts through the pain gate mechanism, and the relaxation of muscle spasms. So mostly it produces the vasodilatation, improve the arterial and lymphatic circulation. There will be softening of scar tissue, breaking down of old adhesions, and cleaning and stimulation of wounds, mechanically removing the dirt, dead tissue and pus in the wounds, and that is mainly the debridement is done, and causing the regression of the inflammatory process, and there will be reduction in the edema or effusion. So the part to be treated is immersed into the water, and then a jet of steam is allowed by the turbulator to produce turbulence in the hot water, and treatment is usually given for 15 to 20 minutes. So Whirlpool can be used in rheumatic disorders, post-traumatic stiffness and joint pain, and it is effectively used in sports medicine for relaxation after practice or competition. So basic uses that open wounds for debridement purposes. For burns we can use it, but if no agitation is used in burn cases. And post-operative orthopedic conditions where water will add a buoyancy element to eliminate the weight of the extremity for the movement. And also we can use it as a resistance force for exercise, right? So if the patient is performing the movement in the direction of the turbulent water, it will assist the movement. But if it is moving against the turbulence of water, it will be giving a resistance. So it can act as a resistance force for exercise also. So basic goal of Whirlpool therapy, it decreases swelling, control inflammation, improves range of motion, decreases pain and decrease the muscle spasm. So these were the Whirlpools. Next is the Hubbard Tank. Now these are large whirlpools which are designed for full body, that is head out immersion, for patients who are unable to stand, and it is mainly designed for underwater exercises. The wide top and bottom and narrow middle, it is like a butterfly shape. Hubbard Tank is like a butterfly shape. They have wide top and bottom and they have a narrow middles. The narrow middles, they allow the room for exercises for the extremities, and also the physiotherapist can assess to the patient for assistance of the exercises. Then patients are typically lowered into the tank on a stretcher by an overhead hydraulic hoist, and it is equipped with 2 turbines that can be moved around the perimeter of the tank to direct and control the agitation pattern. So this is the picture of Hubbard Tank. You can see, and the dimensions: length will be 7 feet 2 inches, upper wing width is 6 feet, middle wing width is 35 inches, and lower wing is 4 feet 2 inches, and the depth will be 22 inches. So in the middle it have less width. So full body immersion can be possible with Hubbard Tank. So patients with arthritis or patients with neurological involvement like paralysis, who cannot actively move the limbs in water with the help of water and unable to do it in the air. Then a burnt patient. So safety consideration for hydrotherapy: first is the prevention of falls. Then precaution for prevention of drowning or any electrical safety has to be considered. Next modality of hydrotherapy is contrast bath. Now this treatment, it involves both hot and cold therapy on same body part. So it has a 2 chambers, in which one is used for hot therapy and another one is used for cold therapy. So we start with cold and end with cold, and affected part should be moved from warm to cold water repeatedly. So basic goal is it decreases the swelling, decreases pain, decreases the muscle spasm. So alternate immersion, one hot water temperature range is 42 degrees Celsius, 42 to 45, and cold one is from 9 to 12 degrees Celsius. And there will be cyclic vasodilatation and constriction, and it can be used for rheumatologic diseases, neuropathic pain and chronic pain syndromes. We can use the contrast bath. So this is a modality of contrast bath. Lastly, we'll be discussing the non-immersion technique. They are the irrigation techniques in which we don't immerse the patient into the water. So pressured water irrigation system. So it is mainly used for wounds where it is impossible or not required to immerse the body part. So it should range between 4 to 15 pounds per square inch, and it is used to treat one patient at a time, and it is usually reusable. So mainly a pressurized water is applied on the wound. So these are the hydrotherapy modalities, including the whirlpools, Hubbard tank, contrast bath, and the non-immersion technique or irrigation techniques. Mostly the students get confused between the hydrotherapy equipments and aquatic exercises equipment. So they both are different. When there is a question related to hydrotherapy equipment, you have to mention all these whirlpools, and in those aquatic exercise equipments they could be floats, weights, and etc. Thank you.